Soon, the country will have to worry about another health threat with cold weather and flu season approaching. Q2's Jenny Fick sat down with a local nurse earlier this week to talk about the confluence of the two viruses.
CDC reports that a record number of flu vaccine has been ordered this year in preparation for the season, expecting many more people to get immunized. I met with Hannah Tugas, a nurse with RiverStone Health, to learn a little bit more about this flu season.
Right now with the pandemic and then having flu on top of that, it makes it even more important to get your flu vaccine. You want to be able to protect yourself from viral respiratory infections.
It is possible for people to be infected by both COVID and the flu, so health officials are reminding people that now is a good time to start thinking about getting their seasonal vaccines.
Determine, is this the common flu or is it COVID? So I would say one of the main things that we don't see with influenza that we see with COVID is that loss of taste and smell. It can happen occasionally with influenza, but we see it a lot with COVID.
So how does the vaccine work?
A common myth with the influenza vaccine is that it causes the flu. It does not cause you to have the flu. What a vaccine does is cause an immune response once you get a vaccine. So your body is recognizing this foreign thing that's been put in, and it wants to fight it off, and that's how vaccines work. So that's how your body then makes those antibodies to fight off if you're ever exposed to it.
Protecting those whose immune systems won't allow them to build any resistance to these threats.
Those that are younger, you're protecting those that are immunocompromised that can't receive the vaccine.
There is also a separate dose for elderly individuals, comprised of a different combination of the A and B antigens designed for this vulnerable age group.
If you're feeling sick, if you feel like you have symptoms, please stay home. Limit your social interactions out in large groups. You want to, if you stay with your household group that's always doing the same thing together, it's really going to help you minimize those exposures out in the community.
In Billings, Jenny Fick, MTN News.